Okay, let's dive into the invisible science that protects us every time someone gets an injectable medicine.
You know, when a medicine goes right into your body, purity isn't just a goal, it's life or death.
Tiny things like bacteria are a huge risk. So how do you even stop a threat you can't see?
Well, they use this process called sterilization filtration. It's an incredibly precise way to purify things.
Think of it like a microscopic gatekeeper. It's a physical wall blocking any bacteria from getting through.
And 0.2 microns? That's the magic number. A pore so tiny that bacteria just can't fit.
To put that in perspective, a human hair is more than 300 times wider than these pores. And it's brilliant, really. It works in 3 ways: blocking, trapping, and just making things stick.
So you install the filter, but how do you know it's working? You have to prove it.
Right? And that trust, it's all built through a super detailed process we call validation.
It's all about building quality in from the very beginning. They call it quality by design.
So validation has to answer some big questions to check every possible risk before that filter is used.
And to pass this final exam, the filter has to survive some seriously tough tests in worst-case scenarios.
First, they literally throw millions of bacteria at it just to prove it can stop them all. Next, they have to prove the filter doesn't have any tiny tears. That's where integrity testing comes in.
A super common way to do this is the bubble point test. It uses air pressure to find weak spots.
And today, automated testers make sure this measurement is precise, consistent, and totally free of human error.
See that graph? That massive spike is the bubble point. It's the big aha moment of the test.
But wait, are bacteria the only thing to worry about? Nope, the filter also has to play nice with the drug.
Yeah, a couple more things can go wrong. Stuff can come out of the filter, or stuff can stick to it. So extractables are things that could leak out of the filter, but only under really harsh conditions.
And leachables? That's the stuff that actually gets into the drug. The levels have to be proven safe.
So you see, this whole validation process isn't just a good idea, it's an absolute must for patient safety.
It's this super careful process that acts like an invisible shield, making sure our medicines are pure.
All this for just one step? Makes you wonder what other invisible processes are protecting us every single day.